Queer Scar Care. Today we're going to be talking about scar tissue that has been rescarred. And the example we're going to be using on my body is I had a piercing on this nipple before it was taken off of my body with my breast and then reshaped and put back onto my body. And we've got a couple more examples.
Yeah, if you tore or had scarring through the birthing process and you know you're going to give birth again, or you anticipate having more scar tissue there, working with that tissue before adding more scarring or trauma to the area can really help with the healing.
Mm-hmm. Yep, if you had, let's say, a gastric surgery of some sort and you have a scar and then you go to have, let's say, a hysterectomy or just scars happening on top of scars. That's what we're talking about today.
Mm-hmm.
So,
yeah, how to care for them.
Yeah.
If you know that more scarring is coming, we can work with them manually to improve the health of the tissue so that the healing the second time around is hopefully going to be more easeful and you'll maintain better health of that tissue going forward.
Yeah, exactly that.
So we talked about castor oil packing in another video. That's an amazing approach that you can
very helpful.
Find out about there.
Yeah.
We're also going to talk a little bit about more generalized massage of an area that has scar tissue, but for today we're really focusing just on the work on right around the area that has the scar tissue or where surgeries happen.
Yep. And if you have a surgery coming up, generally prepping the area, there's a whole nother video all about that you can find.
Yeah.
So. Okay, I'm gonna bring you closer to me and cut my head off so that we can stay focused on the example.
All right, may I touch you?
Yes, please, thank you.
All right, so there's a few things. One general principle is that stretching can be really helpful. So when the collagen fibers are laid down that make up scar tissue, they're all kind of like crisscrossed, and helping align them and show them all the ways the tissue can move can be really helpful. So one way that can look is using one thumb or hand to anchor in the center, putting another hand down and stretching out like a starburst shape all the way around, stretching it that way. And I have heard in massage school this kind of pressure was described as about 2 pounds of pressure, but Ro, you had a good visual also.
I think of it as like when you have old silly putty or old saltwater taffy and it just needs the stretching to re-moisturize, that amount of stretch. So not the like nice chewy, but the like, oh, this has been sitting in the box a little longer, but it's not bad yet. It's full of salt. I'm going to give it a try. That much pressure.
Yeah, exactly that. Another approach you can take is stretching out multiple directions at the same time. So again, moving all the way around. And if you're looking at scar tissue that's more like a line and not a circle, then that's going to be more like coming across from center like this and across the scar line like this. So just thinking of all the different dimensions of movement, stretching it out that way.
Yeah, I had to have revisions on my sides after my surgery, and I know that getting in here and doing all the stretching in advance, my recovery on the sides were so much better. For me, it was just really easeful.
Yeah.
Thankful for that.
Definitely that.
So, also you can use the bones behind here as sort of reverse squashing, and what I will do is press in and just going around, just swirling around in different directions. And that's more pressure, and I'm pressing against the bone and just kind of noticing where there's tension. Like I've got more tension down here, so I'm pressing in here more and pulling in different directions. You can also use a spoon and your thumb. I think 2 fingers is too much pressure, but just one thumb, and just massaging this way. So, and I'm pressing up against the bone behind it. Like we always say with massage though, if you're sore the next day, too far. So you should feel it almost like you had a nice stretch, but not as though you were tearing into muscle. If you go to the gym and you're like, a little too far.
Yeah.
So back down.
Another approach that can be really helpful is called skin rolling, and that really engages the fascia or the connective tissue below the skin, wrapped around the muscle. It's kind of everywhere. So to do that, you're going to try to puff the skin up and roll over it. So it's going to look a little bit like this. And again, that you can do in all different directions. So I'm going back and forth here, and then I can go up and down. Trying to give you a good view there. This one can be kind of intense for some people, so go gently with this one.
It's nice. I like it, but
it can be very
different
effective.
strokes for different people.
And that helps the way that scar tissue can kind of lock down to other layers of tissue that otherwise would have been moving more fluidly. That skin rolling really helps to separate out tissue that doesn't need to be connected and then allows for more fluidity of movement. So that's the rationale behind that one.
Yeah, folks might not know, but scar tissue will reach out and anchor itself, right? And that's what we're trying to give it, stretchiness and elasticity. So wonderful safety mechanism. Now calm yourself.
Anything else you'd like to show today?
I think that's it, y'all. So if you've got more questions about queer scar care of any kind or scar care, let us know. Reach out. You can DM, you can leave a message here. So yeah.